You are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us. Hello, and welcome to another exciting episode of In the Ladies' Room. Now, many times we have topics where I say, okay, this probably isn't great for the kids, but today the kids are going to love this topic because we're talking to the Booger Lady. And I'm going to find out how she got that title, but I'm guessing it was from a 5-year-old. Speaking of 5-year-olds, are you ready for cough, cold, and flu season? Of course, the most important preventive thing to do is to get your flu shot, and I'm getting mine right after this episode. But beyond that, our guest today, pediatrician Dr. Hana Solomon, her real name, will give us her best tips for children and the adults who love them about how to handle snotty, runny noses, and other cold and flu symptoms. Among other things, she's the author of the book, Clearing the Air, One Nose at a Time, Caring for Your Personal Filter. She's a board-certified pediatrician, mother of 4, an author, an inventor, an entrepreneur, and has a fascination with the nose and teaching what she calls the art and science of nasal washing. I loved her book, and I particularly love this quote. The nose has the power to change your entire consciousness and mood in a single second. The nose is our gatekeeper, our personal filter, and our great defender. With that, please help me welcome Dr. Hana Solomon. You are in the ladies' room.
Thank you. What an honor to be invited. I am really humbled, and I thank you for allowing me to share what I know.
Thank you for joining us. And I think what you know is really going to help a lot of people. But please first tell us, how did you get the name the Booger Lady?
Okay, let me start with, I'm an immigrant. I was raised by my immigrant mom and grandparents who spoke no English. And so as a child, I was taught that you had chicken soup when you were sick, and you only went to the doctor when you were near death's door or for a well child.
So I'm guessing you were from Eastern Europe.
Yes.
Okay, so from where?
Well, I was born in Germany, but I'm from Polish descent. But after the war, my parents were in a displaced persons camp, and then I happened to be born, and then we immigrated to Brooklyn.
So I'm from Brooklyn also, and I grew up in a Jewish family where chicken soup was called Jewish penicillin.
Thank you. So fast forward, I leave New York City trying to find the reason why I was placed on this earth. And I joined a spiritual commune, the largest one in the country at the time, called The Farm.
Okay.
And our goal was to show the world how we humans can join together and cooperate, live off the earth, and do no harm.
That sounds like the 1960s.
Exactly. Yeah. So, but after 4 years of living there and having 2 babies, midwife, and everything natural, I realized that I needed to empower myself with education, and that I saw that no matter how wonderful I wanted to make the world, I couldn't change the fact that some people will always be takers. And the way to help people is to empower myself so I can empower others. So I leave the farm, single mom of 2 kids and no college. And 3 years from that day, I enter medical school.
Wow.
Thank you, God. Because I was older, I heeded my mentor's advice, especially the old doctors who taught you about listening, about touching, about caring enough to think about what this may be after you really learn the entire story. I won't go much into that, but one of those mentors was Dr. David Parsons, ENT, pediatric ENT.
So for people who don't know, an ENT is an ear, nose, and throat specialist.
Thank you. So, and he taught me, he said, Hana, if I could get everybody to wash their nose, I would never do surgery again.
Wow.
Well, fast forward.
Oh, there's still polyps.
But if you keep washing, you can reduce the growth of polyps, because polyps are a result of chronic irritation. But I heeded his words. I became a pediatrician, and I very soon became a snot nose expert because every child who wasn't coming in for a well child had some issue that related to the nose. We're talking about ears, sinuses, bronchitis, asthma, postnasal drip, snoring, voice issues, hearing issues,
Allergies.
appetite. Thank you. So, and I wasn't willing to give antibiotics to your child because I wouldn't do it to my own, because I had two rules. Don't ask a 2-year-old to do something that I myself cannot do, and treat my patients as I would want my own family to be treated, which is, let me share what I know, you tell me what you have, and together we'll find that solution. I
So
took
I want to follow up on I just want to interject about your comment on antibiotics. Of course, antibiotics can be life-saving, and
Yes.
you're not opposed to antibiotics when they're indicated. What I
No.
want to clarify for people, and this is one of my big pet peeves, is this issue of antibiotic resistance, is that what you really mean is I could give you a truckload of antibiotics for a cold or a virus, and it's not going to help, not because they don't work, but because they don't work for those kinds of infections.
And
So, and one of the things that pediatricians are always complaining about is that parents always want a prescription. What's interesting, for whatever ails them, even though it's not going to help. What just came to my attention today, though, is somebody brought up the point on Twitter that a lot of preschools and elementary schools have a rule that your child has to be on antibiotics for 24 hours if they have any kind of fever before they can come back to school. And yet antibiotics are not indicated for gazillions of infections that cause fever. So you want to
80
address
to
that?
90%, 80
How
to
many
90,
percent?
80 to 90%.
Wow.
But I wanted to add one more thing to your list,
Mhm.
in addition to it not working, in addition to the cost. But maybe the most important thing, two things. One is the resistance. And later down the road, that antibiotic won't be that miracle drug for you. The next thing is that we know for sure now, 30 years ago, I knew it instinctually. Um, we know now if young children are on antibiotics more than 3 times in a year, repeatedly, they are in much higher risk of developing autoimmune issues.
Wow.
We also know that now we know that nasal washing with the right stuff, very super salty, but buffered so it doesn't burn, the right stuff. And it's the stuff that Dr. Parsons gave me, the recipe that's been used in the operating room for 40 years. Not patentable, but that's the one I use because I feel in my gut it's the best one. It is shown scientifically, when you look at one study, it removes 80% of the inflammatory mediators in your nose.
So when you're talking about nasal washing, are you talking about what people refer to as using a neti pot?
Thank you for that question. So I could not use a neti, and
I couldn't either. I tried it. It was.
and that was the only thing available 30 some years ago.
Mhm.
So I took a generic soda bottle,
Mhm.
and I started using it with my patients. I bought generic little plastic soda bottles with a cap. I gave them the recipe, and eventually I would go home and make them myself and label them in tiny Ziploc bags. And then I accidentally realized what I was wanting to do. I knew that it was much more comfortable to wash along the nasal floor and not up like a neti. When you're using a neti, you're bending over and you're twisting so the water is entering into your sinus cavity. That made me feel uncomfortable, but it also, in my gut, didn't seem right that all the debris, 10,000 liters of air in 24 hours,
Mm.
why would we push that into a sinus cavity? So for me, nasal washing has always been called nasal washing, not sinus rinsing.
Okay.
If you go along the nasal floor, you create a negative pressure at the sinus osteomedial complex, the intersection of all the sinuses, for those who don't know, that's up here. You cause a negative pressure. So this flush is going along the nasal floor, and the sinus gets this negative pressure, this natural come on out, which is what we're supposed to do with the sinus contents.
So you have told me that you have taught 2-year-olds how to do this. Do you have a video of that that people can watch? So where can people watch the video to see how to properly do this?
Well, I have many videos on YouTube. Just look at nasopure.com or my website. Anybody can always email me directly. I love
Nasopure is NASOPURE, so that's nasopure.com.
And they can email or call me anytime.
They're calling you now.
Because I often FaceTime with folks, because it's a different process. The way that I get it with 2-year-olds, and there's one YouTube video that I wanted to brag about. They are my patients, 3 little patients. The older brother, who's about 8 in the video, he started when he was 2. And then he taught his sibling and the next sibling, and it's in the video. And that was a homemade video. I didn't make that. If you, just like you teach a 2-year-old or an 18-month-old how to brush teeth, it's a common sense thing. Mommy is doing it. Here, hold the brush. You go to where they are, whether it's a 2-year-old, and I must tell you, adult men are much harder.
Well, we have often talked about on this podcast the similarities between adult men and 2-year-olds.
Really? I have learned that I can teach about any child that I've never met within 5 minutes. There's actually a video of that me teaching a 4-year-old at some show. I'd never met this child, and she had been a little tortured with her nose. So those kids are a little hard. And on the video, within 3 minutes, she's washing.
Well, I love this concept of calling it washing your nose, the way we teach kids about washing your hands. And of course, the number one, most important thing, as I said earlier, to preventing the flu is getting your flu shot. But of things that you can do on your own, the number one thing is hand washing and frequent hand washing. And so you're suggesting that we need to add nasal washing or nose washing to the mix.
Because, number one, we know with 100% certainty, and Dr. Grosson in 1975, the grandfather of nose washing in America, I think, from Southern California, stated a hypertonic buffered makes an environment totally uninhabitable for bacteria and virus.
So explain to people what explain to everyone, out there who's not a physician or a scientist or a chemist, what a hypertonic buffer is.
Okay, so your body is called isotonic. The same salt amount as your body is called isotonic. And hypertonic is saltier than the body. And it's like going swimming in the ocean or maybe the Dead Sea. The reason we add buffering when we say we want you to wash with hypertonic is salt alone. Like if you go for a swim in the ocean, it is salty and it burns a bit because it's a different pH than your nose. If we add buffering, like sodium carbonate, and we add, by the way, the most on the market, 1/3 of ours is buffering. Our competitor is 3% buffering.
And you're adding this to what kind of liquid?
We are adding a already mixture of sodium chloride, sodium bicarbonate, pharmaceutical grade. It's pure, it's very fine. And then you add it to a bottle of either a kid bottle or an adult. I like the kid one personally. I should start calling this my favorite. And you add water to it, which is either previously boiled, bottled, distilled, sterile. Mix it up, hold it up.
And what temperature should the water be?
Good question. I find that some people, especially athletes and muscle kind of really strong people, like cold. We find it refreshing. But for most humans who enjoy comfort, I think body temperature is the way to go.
Okay, and why does the water have to be boiled or distilled?
Well, we don't want any foreign materials, bacteria, amoeba, any things that can harm um, your body. And this has become a big issue, not because it's really a big issue, because I would argue that overprescribing drugs is a much bigger issue. And I would argue that doing many surgeries that are unnecessary is a much bigger issue. But there's been approximately 3 or 4 people in the last few years in the United States that either at some point used a neti, but most often was swimming in a lake that had an amoeba.
Mhm.
And we don't know what kind of salt they used, if any, because enough salt will kill it. And those people used a neti, and that infection crawled up the nerve and entered the brain
Oy,
and
I
killed
saw
them.
that on Grey's Anatomy once.
Yeah, it's a very rare thing. I think it's happened 100 times over the last 100 years. But and I've written an article about this, it is true, and that's why we changed to that water.
Got it.
We want
Okay.
to be careful. Yeah.
So who should be doing this? Who needs to be doing this, and who can this benefit the most? Is this something that you're advocating that everybody should do, or just people who have
A
issues
nose
with their
issue.
throat? I'm
I
sorry?
think if you have a nose issue, is my answer. I think um, prevention makes sense. I'll give you examples. During the winter, if I'm traveling and it's flu season, even though I got my flu shot, even though I wash my hands, um, I wash my nose after being exposed to large public places. Or if I'm mowing and the wind is blowing and you're gardening and you feel these crusty things, to me it is a good time to wash it out, because if I don't, then those allergens will have chance to invade my nasal membrane and cause me to have allergic symptoms. So it makes sense to wash if you've been exposed to something, or if you're on any meds. To me, I would rather wash my nose than use a steroid for my nose.
Mhm.
It's a
So when
little
you
bit,
talk about a steroid, you're talking about the steroid nasal sprays or the nasal sprays that are given to people for allergies. Yeah, obviously there are a lot of people who have many other diseases and diagnoses who take oral steroids,
right.
like people with asthma, etc. Talk to me about how this works, or how this could potentially help kids with asthma.
I'm so glad you brought that up. So I bet you can agree with me if you look back at your patients who've had asthma, not the acute reactive to a chemical, but in general, those patients almost always have preceding nose and sinus issues. Number one. Number two, we know that most people who have asthma are breathing through their mouth. And when you breathe through your mouth, you don't allow the nose to do its job. It humidifies, it filters, and it warms the air you breathe. So now you're breathing unfiltered, unwarmed, unhumidified air, goes down to your bronchial tubes, and you're coughing. There are many.
Interesting. I never thought about it in terms of it being a mouth breather bypassing the natural filtration process. That is fascinating. And I always obviously knew that there were many kids with nose problems who were mouth breathing as a result. And even both my own kids had problems with asthma when they were younger. But I never thought about how you're then losing the natural filtration.
And when you think about asthma, it's not just the coughing and the wheeze, and they can't go play soccer. They're not sleeping well.
Mhm.
They're not thinking well at school. They're also not eating well. And now they're having to be given medications that maybe some of it can be reduced if their nose is cleaned. And we know that's true. It's true for a fact. My hurdle has been, um, how do I actually share my experience with other influencers? mostly doctors want you talked about most parents want antibiotics, but really, I would say most parents want a fix. They want an answer. And I think if the doctor slows down enough, and it did take me a lot of extra hours in the beginning, asking patients every detail so that I can learn from them their experiences and what's helping and what's not. And if I
I
was
think what parents want is they want their child to be breathing properly. And of course, the number one thing we want is we want to be able to sleep through the night. When your child's not breathing properly, you're not sleeping. Nobody's sleeping. So, that's certainly extremely important. And you don't want your child to be uncomfortable. But let's talk about this bridging now between the child population and the adult population, because there are certainly millions of adults who have problems with asthma, allergies, chemical reactions, constantly mucousy noses, post-nasal drip, that annoying cough that you get as a result of the post-nasal drip. I can always tell the people on the airplane who have that.
And the list goes on. You didn't mention the polyps, the enlarged turbinates, and those who still have adenoids and tonsils. And those shouldn't necessarily be taken out, but those in adults can cause problems. So the list goes on. And so, we took an oath, first do no harm. Mm-hmm. So doesn't it make sense? We're talking about a dirty cut on our knee. Why would we spray a steroid on that mud before we wash it? I've always been under the impression or the opinion that if you eat real food and you keep your nose clean, you can stay pretty healthy. A lot of it is in the foods. And so when we talked about doctors and the response to the parents, I would often bring up the environment and the diet.
Well, one of my mentors was Dr. Doris Rapp, who, as you know, was a pioneer in the issue of children and food allergies and the effect that food allergies have on their behavior. But certainly having nasal problems and having asthma and allergies and other related symptoms can also cause behavioral problems in children.
Right.
In large part because they're not happy. But interestingly,
yeah.
You talked about, you used this phrase, keeping your nose clean. When I was a girl, that phrase was used to mean stay out of trouble. Keep your nose clean. Don't get into trouble. And it's kind of an interesting dual entendre.
It is true. I love that more Americans are discussing it. When I first started, my colleagues thought I was a little
Well, Dr. Rapp used to talk about how she got a lot of pushback from a lot of her theories about food allergies. And now, of course, we know that food allergies are a huge, huge problem. But I need to go take us back to the beginning of our little chat. You never got to the punchline of how you got the name the Booger Lady.
Somebody once called it, but maybe it's from about 3 or 4 years ago. I was on a radio show. And it was in Hawaii, and somebody was Polynesian, maybe the host, but they told me that my name Hana means booger in Polynesian.
Oh my goodness.
And I also understand that Hana in Japanese means flower and smell. So I think that my mom just knew my destiny, or maybe.
Well, if it makes you feel better, Hana in Hebrew means God's gracious gift, or a gracious gift from God. So that should make you feel better.
I lived in Israel for a year when I was a child.
So I love your book. I talked about the book in the intro. Where can people get your book?
They could get it on my website, nasopure.com.
Mm-hmm. And it is available as an ebook. And of course, I immediately scrolled through the table of contents, and my eye went directly to page 23, where you talked about sexuality in the nose. So, of course, in the ladies' room, we're always talking about things. Our goal is to talk about things that are embarrassing or intimate or that people don't always talk about. And I thought, this is a topic we've never addressed, is this concept of the nose as a sexual organ. Now, you went into the anatomy of the nose and talked about how the tissue of the nose is similar to erectile tissue. So you want to explain that?
Identical. Okay, the erectile tissue, more visually apparent in the penis, the reason it gets erect is it has tissue that's like a sponge, that it gets engorged with blood instantly when it gets stimulated. That same tissue is in our turbinates, and the turbinates are those folds of tissue that allows that 10,000 liters of air to be processed. It gives you more surface area. Problem is, when they get large, they start blocking the openings.
And these are the turbinates in the nose.
Yes.
And the venous sinusoid tissue is in that apparatus.
Absolutely. So when you go to a bar or you walk into an environment where there's some chemicals that make you, what is that? You could sometimes, you'll complain of feeling dry, but in fact, you've had instant engorgement. And I think it's the survival message of back out. It's swelling up because it's trying to decrease, I think, how much goes in there. But it does. It instantly engorges. It is fascinating. And we talked about the smell and and how you can smell someone and just fall in love. Or you can smell someone and go gag and vomit.
And start running for the hills.
And for no reason except for your life experience and your memories. It's very interesting. I love it.
And the reason that we presume when we're talking about sexual attraction is pheromones, which we have discussed with various sex therapists on this show before, and mostly because I'm fascinated with the whole concept of pheromones. But one of my favorite studies that I ever read was with a very large group of young people in their 20s, and they were all single, and they had women smell the sweaty t-shirts of hundreds of men, one of which belonged to their own brothers. And they found in this study that the women identified the sweaty t-shirts of their own brothers as the most repulsive and the most distasteful. And I thought that was just a fascinating finding, and probably evolutionary, that you don't want to be attracted in any way to your own brother. And then when they did it with people who were coupled, in a majority of the cases, the women were able to be most attracted to the sweaty t-shirt of whoever their beloved was.
Really?
So I thought this was super fascinating.
I love it. I love the magic of our system, our body, and how it works in total. It's pretty amazing.
Well, that whole knee bone connected to the shin bone thing actually works. But in that respect, and getting back to nasal anatomy, and of course, form is based on function. So the anatomy is based on what it's supposed to do. I don't think most people think about the function of their noses beyond holding their eyeglasses up, or beyond what their noses look like and how their noses affect their appearance. And certainly there's tons of surgeries done because of appearance of the nose. And we actually did an episode on plastic surgery in teenagers and how that, and cosmetic surgery in teenagers, and how that's really been on the rise. But talk to us about the anatomy of the nose and tell people what the nose is actually connected to and how the nose and the sinuses interrelate.
Okay. I wish I had my papers I could draw or something, but
most people are listening as a traditional podcast, so most people aren't even seeing the audio.
Okay, excellent.
So you have to paint a picture with your words.
Oh, excellent. I'll try. So the septum in the middle between the two nostrils only goes halfway back, so to speak. So the nose, everybody assumes, goes upward. If you speak to somebody about anything, they assume it goes up. But in fact, most of the canal is straight back. It's parallel to your soft palate. And so we talked about these turbinates, which are folds of tissues. And under the first turbinate is where the eye drains. Important, because if I'm mowing the lawn, even if I have goggles, tight-fitting goggles around my eyes, when I breathe in, I will have retrograde, or the
Reverse.
the reverse will go up into my eye, and I will develop eye symptoms. So it's important to know that's where your eye drainage. And that's why you don't want the first turbinate swollen. The next turbinate is the second one, and under it, towards the very back, is the opening of the maxillary sinus. And then there's a little third turbinate. When those enlarge, they really cause a problem. Sometimes they'll enlarge if somebody has what every ENT loves to put on every visit, deviated septum. Everybody has a slight deviated septum. I don't care who you are. Just like your hands, your breasts, nothing is exactly, maybe some few people. But for those who have severe septal defect, the turbinate will compensate the dead space and grow to fill that. That is a time when you need surgery, when there's a significant deviated septum.
And the surgery that would be indicated is called a septoplasty?
Septoplasty, and it just puts that halfway wall back in the center, which doesn't allow the turbinates to enlarge. We also know that the turbinates like to enlarge when it's exposed to irritants. Sometimes people grow polyps on the turbinates. They look like hanging grapes, and they grow and grow, and they really become a problem. They too grow when you have a propensity to that. And if you're exposed to irritants enough, the problem with polyps is they have very, very deep roots. So even if you have them removed, they often grow back. So you always want to stay away from the surgery suite, because once you go in there, you may have to go back a time or two or three. Same with sinus surgery. That has been shown to be true.
So with nasal washing, we talked about your recommendations for people if they're exposed to irritants or if they have a cold. But what is the frequency that you recommend for people? Is it a daily thing?
I think if you're not going to do it daily, then at least do it after exposure. I do think it would be helpful to do it daily, but I don't want to sound like a car salesman. But I think after exposure, if you have any symptoms, or if you're in your season, your allergy season, then you should do it twice a day. If you're sick, you should at least do it 3 to 4 times a day. 3 to 4 is good. And then we have the issue of chronic sinusitis, or an infection that just keeps coming back or dragging on 3 to 6 months. And now you've developed this thing we all don't want anybody to have, which is called biofilm.
Okay, so explain what biofilm is.
Biofilm is a bacterial matrix. I envision a biofilm to be similar. You have a muddy cut, you wash it off, and the new tissue that begins to develop, the beginning of a scab, but it's wet. Mm-hmm. I think that's what biofilm, I imagine that. But it tends to be resistant to antibiotics, and it really is a problem. Well,
it's not really an infection, is it? It's more of an inflammatory process.
The biofilm is a chronic inflammatory process, but it's made of bacterial pieces, and nothing breaks it except
washing.
Baby shampoo.
Oh.
1 or 2 drops in a hypertonic will cut the biofilm.
Oh my goodness.
I have heard this many times. If you look up the boogerdoctor.com, he's a pediatric ENT who's gone natural. He uses it. I have witnessed it in maybe 100 patients who have called and said it worked.
Wow. So,
But
you know, it is kind of fascinating that we pay so much attention to washing our hair, but we don't pay attention to washing our noses, which are responsible for the filter. And the visual image that I was having when you were talking about the nose being a filter and therefore needing to be cleaned, that I think is an easy metaphor for most of our listeners to understand, is every time I run the dryer, I clean the vent filter. You know, and every single time I run the dryer, despite the fact that the clothes were just washed, there's all this lint that comes off. And I think that might be the visual metaphor for people to think about washing their noses.
I think another explanation in addition to what you just said is Americans in the past have been used to going to the doctor and getting a pill for every ailment. So that's number one. Number two, the dryer filter and your hair and the lipstick and the eye makeup and the clothes are visual, and Americans tend to be more in tune to what they see. But I think if you take the time and educate folks about the nose, then they may think about it. I love to talk to teenage guys who are, and then I go, but you can't kiss a girl. Plus, your breath stinks because you're not breathing through your nose. Or just going, or if it's a 50-year-old on a CPAP machine. There's just so many reasons to first do no harm. If something's not working, why don't we just clean it? And then see how it goes. And
yeah, I've had that problem with my computer. Sometimes it just needs to be specially vacuumed out with these special computer vacuum that the geek guys have at Best Buy. And that seems to work, or removing the dust, or we certainly get our oil changed in our car. You know, I've said many times on this program that Americans pay much more attention to maintenance of our cars than maintenance of our bodies. But the car, of course, comes with a manual that tells you at every 1,000 miles, you know, what you're supposed to do. And our bodies didn't come with that instruction manual. So that's one of the reasons.
And we're learning as we go. We're not, you know, I'm not putting anybody down. 30 years ago, we were taught, you got a snotty nose, you give amoxicillin. Mm-hmm. But at some point, you have to look back and go, is this making sense? Is this helping our children? And it wasn't.
Right, and 30 years ago, we weren't doing evidence-based medicine, or we weren't looking at study results, and we certainly didn't really pay attention to antibiotic resistance. And of course, along with antibiotic resistance, we also have to tell people that antibiotics have symptoms of their own. And some of those symptoms may be as benign as an upset stomach, but they can certainly upset the microbiome of the intestinal system, which we've talked about on this show. But they can also cause severe side effects that can cause, you know, hearing loss or neurologic complications and other things. So these are all things we need to know about. Anyway, we could talk about this all day, but we're running out of time. So I just want you to give me your top tips for flu season. And I'm guessing number one is wash your nose.
No, I think during flu season, you eat real foods. Mm-hmm. If the food has 79 ingredients and you can't, and it's going to sit on the shelf for 29 years, probably just eat real food. Stay well hydrated. If you're exposed to influenza, like it's in your community, I would suggest washing after exposure. I think the flu shot is a really good thing. Coughing in the crook of your neck.
In the crook of your elbow.
I'm sorry, in your elbow, of course. I got honors in anatomy, believe me.
But we all get flustered and we all misspeak. And crook of the neck is an expression that we use far more commonly than crook of the elbow, especially when you get to be my age.
Thank you for correcting me. And I think I mentioned it all.
Okay, hand washing, very important.
Countertops. You know, we didn't talk about countertops, but when you're going to the grocery store, when the kids are being exposed to the handles, you hate to get neurotic, but you got to keep things clean.
Right. And we don't have to use antibacterial soap. That's a whole nother issue. But the other thing that we often overlook in terms of flu season and being developing your own body's natural immunity is certainly sleep. And we've talked about that in this podcast with the sleep doctor. We've had the sleep doctor, the fibroid doctor. We even had a doctor whose nickname was Dr. Lady Doctor.
The GYN?
What?
The GYN?
Yes, Kelly Caldwell.
Very appropriate.
Yes, absolutely very appropriate. And before I let you go, I was remiss. I usually ask this at the top of the show. But now that you've had your interview in the ladies' room, aside from this interview, what has been your most unique, different, interesting, or unusual experience that you ever had in a ladies' room?
In a ladies' room?
Any ladies' room. And one of our Olympic athletes asked me to include locker rooms as part of the ladies' room.
I don't know if I'm going to be a very good guest here for you.
I think it's okay if you never had a memorable experience in a ladies' room yet.
I have to say, I sometimes have bowel problems, and I think the thing that keeps coming in my brain is when I had a bout of diarrhea and I leaked everything, and it was a mess. And but that's not a pleasant.
That's pretty memorable.
Yeah, very embarrassing, and that's what I remember.
We actually had a previous episode with a gastroenterologist, Dr. Hana Hindi, another Hana, although I think she pronounced it Hannah. And she actually had severe inflammatory bowel disease when she was in college. And that is what motivated her to become a to go to medical school and also then to become a gastroenterologist. So we love those kind of stories. Anyway, I want to thank you so much. I want to thank everybody for listening. I want to welcome everybody to get more information at nasopure.com, and also to send us any questions that you have to our email, askdrdonica@gmail.com. Dr. Donica is Dronnica. You can always find us on Instagram, Twitter, Facebook. And I do have to make a special plug for why I'm wearing a burgundy sweater today, because it's the first day of October, and burgundy is for livers. It's Liver Awareness Month. So I want everybody to go on Instagram and join us in the Living Burgundy challenge to raise awareness about liver diseases. Anyway, thank you so much for joining us. I am going to try this. I am going to recommend it to all my snotty nose little friends and my adult snotty nose friends. But also, in all seriousness, the other group we didn't talk about, who I think this is wonderful for, is singers and vocalists and actors. And I know a few of those.
You do? Well, I do have one Metropolitan Opera singer who has been using it and tells me it has changed the course of her ears, nose, and throat visits. Mm-hmm. So yes, it's good for voice. And it makes sense, right? If there's no drainage dripping on the vocal cords, they're free to behave.
Well, and singers are very reluctant to take any kind of medication that will also dry out their vocal cords or dry out their sinuses or nasal passages, because that can affect the quality of their voices. Anyway, thank you again for joining us in the ladies' room. We know people will love all of this information, and they'll be rushing to look up your book, especially page 23. Take care, and look forward to joining you in our next episode of In the Ladies' Room with Dr. Donica.
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Donica. And please join us next week for another episode of In the Ladies' Room with Dr. Donica. Real conversations with real women about really intimate topics.